Can everyone hear me okay? All right, so good afternoon, everyone. My name is Tristin Faust, and I am a microbiologist with the Eau Claire City County Health Department. I've worked there for about 8.5 years now, and I am just very grateful to be here today to talk to you about what we have done at our local lab. So my goal and overview of this presentation today is hopefully give other organizations or other local health departments ideas on what has been successful for us to increase our testing capacity, create more awareness and education about the importance around private well water testing, and maybe how to reduce some barriers. And I'm also going to discuss a little bit about our outreach strategy to medical clinics in our area, and then a little bit about our PFAS response. So we are a mighty team of three. So I'm one of three members in our small local lab, and so we're lucky that we do have three full-time lab staff capacity. And so we're a certified state lab to test for bacteria, nitrite, nitrate, and metals in drinking water. And annually, we analyze about 3,000 total drinking water samples, and about 2,000 of those would be for private wells. And we have a lot of people testing for different reasons. We have people testing to do their routine testing, real estate transactions, new well work, pump work. So there's some certain testing requirements if people install a new well or have pump work done. Maybe their neighbor tested and they're testing then out of curiosity, or our transient non-community well water systems like our campgrounds, bars, and churches. So I wanted to show just a brief graph, and I apologize, this is a lot of numbers on this graph here of just some of our testing numbers over the last few years. And so you can just really see in the last few years the increase in testing that we have done, partially due to installation of some new lab equipment, our ICPMS, which I'll talk about in a few more slides. And then we really just have a highly motivated team that we want to do whatever we can to keep breaking numbers and seeing that bar each year increase. So we're always wondering, what else can we do to motivate people to test? Specifically then in 2024, we did have a few special grant-funded projects that we did. So that's why that's a little bit higher there. And then in 2025, but I am optimistic that in 2026, those numbers will be above 2025. So about 30% of Wisconsin residents get their drinking water from private wells, and in Eau Claire specifically there, you can see highlighted in red on the map of Wisconsin, we have about 9,000 private wells. And so we're west centrally located in the state, and given our capacity that we do have at our local lab, which is pretty large for a local lab, we just try our best to support other local health departments whenever possible. Okay, so starting off on our journey, we purchased an ICPMS piece of equipment. And we purchased this because we had a piece of equipment in AA that was running into some problems, so we needed to decide if we wanted to put money in to fix it or try to see if we could secure some funding to upgrade our equipment so that we could be more efficient, provide more testing to our community. And so we did have some ARPA grant funding through our county, and we were able to secure that. They felt like this was a great priority for our county, and so we got that funding to get that piece of equipment. And this really allows us to run more metals per sample. And so that allows us to do cheaper bundle option testing and quicker results, especially important for real estate transactions when we're getting calls from realtors every other day. And it really just provides us with better water quality than for our county, or data for our county. And so we really talked about offering bundles for a long time. And when we got then this piece of equipment, we decided that we really needed to figure out how to do that. It seemed so simple, something to do, but really just given our lab management software, billing capabilities, it was actually pretty difficult to put together, but we did get that, and so you can see there that we do offer these different tiers of homeowner bundles, which has been so helpful because a lot of times people just don't, they get overwhelmed and they don't know what to test for. So that has been really great for people just wanting to check a box of what they want to pay for and get the testing completed. So the next piece of equipment is an IDEX Tecta 16, and this allows us to accept samples on a Friday or before a holiday. So we really had a lot of feedback from our well drillers, our contractors, home inspectors, that Friday drop-off or before a holiday would be really, really nice to have in our county. And so we got this last year, and we're still kind of trying to figure out how to use it because we can only accept 16 samples, so messaging that to the public is a little bit difficult because we don't want someone to come in, we have to turn them away. So right now we are just offering it to our bigger clients, our bigger customers. They do have to call us and reserve a spot to make sure we have capacity to take their sample. But really what this is, it's an incubator in a box. You pour your water sample into a vial, you put it in the machine, it emails us a result with presence and absence for total coliform and E. coli, and quantitative analysis of that too. So that has been very helpful, and it's nice too when we get a private well owner walking in on Friday, they didn't read their paperwork, and they don't want to turn all the way back around and resample and bring in a new sample. Usually we have capacity to accept those samples. So trying to just increase some general awareness about well water testing in our county. We are always trying to think of ways that we can do education that's realistic, quick for us to do, and affordable. So we do all the permitting for our new wells in our county. And so when we mail them their permit, we decided to include this flyer that then educates them that when your well was drilled, it was tested for bacteria and nitrate. More testing may be desired. So we just really wanted people to know that because we had calls from people saying, well, I have a brand new well, it's great, it's safe water, right? Well, it was only tested for those two contaminants. So we then just try to educate them that more testing may be desired, and even testing them then our lab does not offer, like PFAS and VOCs, pesticides. And then we also included an FAQ on the side to try and go through some of those common myths that we hear from people of, well, if I have unsafe results, you're gonna come and shut down my well. No, this is for your information only. You can do whatever you want with your results. You can install treatment or you can not. So just tried to get ahead of those questions. We also administer our state code, which requires all septic systems in our county to be maintained. So we send reminders out for a routine inspection to 3,000 households every 3 years. And we thought of this year, if we're mailing these notices out to people that most likely also have a private well, we should include a bright piece of paper with that notice saying, have you considered or have you done your well water testing yet? So just another easy way to get more education and remind private well users about the importance of testing. And so far, we've had a lot of people come back to our lab and they bring their paperwork and they ask about, hey, what's this new water testing information about and get a test kit. We've done a lot of other things, a lot of other partnerships. I'm not going to go into detail on them, but we really try to partner with our local university whenever possible. We did partner with them to do a groundwater study, and then we also did some PFAS sampling with them. We did a county land conservation department groundwater study with our neighboring county. Our own land conservation department will offer discounted well water test kits to farmers that come to nutrient planning workshops. We've really tried to expand our K through 12 education by either doing job shadows, providing lab tours, and attending STEM events whenever we can. We combine radon and well water testing information, a lot combined to the public, since those are two things that you should consider testing in your home. And it also seems that radon usually has a lot more funding than we do in our department, so they are happy to help with getting that education materials printed and information out to the public. And our Home Builders Association has been really great on including information from us whenever they can to their members. And then things that I think a lot of people do, keeping test kits in accessible locations, town halls, really leveraging your town halls during spring elections or any elections, so that we can just get the information out there to more people. So in order to try and increase convenience of obtaining a test kit, we just started trying to implement this here in 2026, and we've wanted this for a long time. Again, it seems like such an easy thing to do. Put a button on your website, order a test kit, it gets shipped out, but just with our website capabilities, our billing capabilities, we came back with a lot of roadblocks. But we did then finally get this up and running. And we've had about over 100 now, probably 120 online test kit orders since February. So that's about in the last 3 months, and a 67% return rate. So we think that's doing pretty well. That was during our discounted water testing promotion, which I'll talk about next. So that could have increased that number a little bit of return rate, but so far it seems like it is working. To try and address the barrier of cost, we do a discounted well water testing promotion 1 to 2 times per year. And historically, during this 1 to 2 week period, we would get a total of about 45 samples. Starting in 2023, after we got the ICP-MS and were able to offer those homeowner bundles, now we see anywhere from 150 to 300 samples during those 8 days that we accept samples. So, and it's really, I would say, closer to that 300 number. So that is really encouraging. A lot of people really look forward to these opportunities. So we try to give them a discount on our premium bundle and then the basic bacteria and nitrate. And this is just some examples of how we do our outreach. We do a press release, social media. Our community health educators are wonderful, helping us stay on top of trends and do cool reels and things to engage whatever is trending on social media. Of course, we partner with our libraries, get on the evening news broadcast, do interviews so that it's on the news, newspaper, hanging up physical flyers in rural locations. We had a spring election this year, so partnered with all of our town halls and provided test kits at each of those. And then we had a county-wide recycler mailing that goes to every county resident in our county. And so then we were able to get like an ad in that. And now we've done that for a couple years now. And again, it is just putting information out there. It's a free way for us to get that information to every single county resident, which is just huge. We're not able to pay to send a mailer out to everyone. So looking for those opportunities when they come arise. Trying to decrease some barriers, more so for our larger clients like well drillers, pump installers. We have tried to implement a courier service. And then we had a small grant in 2023 where we told folks that they could maybe drop off their samples from 6 to 8 p.m. on a Wednesday. We'd be there on Thursday morning to pick samples up. And we had some interest, but really not enough to, with our capacity to keep that running. So at least what we tried to do is we did reach out to some local courier options and see where their routes went in our county, and specifically to our different like well drillers and home inspectors, where their offices were. So we at least put together a flyer for when we get those questions about a courier service, that we can give them that flyer. Okay, so now I'm just going to talk a little bit about something we started to do last year, our medical collaborations. First off, so we offer a free newborn test panel to anyone in our county that is expecting or has a child under the age of 1. And that test includes bacteria, nitrate, lead, copper, and fluoride. And so first, what we did with this project is we targeted small dental clinics, chiropractic offices, and wellness clinics to just see if they would want to carry our brochures, keep them in their waiting rooms. So we usually have 2 students in our lab that help us with all of our daily activities. So we created a script for them to follow, and they called every office and determined who was interested in having our information at their clinic. And pretty much all of them said, yes, absolutely. We're very appreciative of us reaching out. So then we drove to each place, gave them a stack of brochures, test kits if they wanted it. One of the larger wellness clinics in our area wanted test kits, so we gave them quite a few. And so we will then now reach out to them again to see if they just need more materials or anything else that we can provide for their customers. The second phase of this project was trying to get into the larger medical hospitals, which was difficult because it's very difficult to find like a point person to call and talk to. So first we have about 3 large medical systems in our area, and so we first wanted to try and get into pediatrics, family med, and our OBGYN locations. And so again, we created that phone call script for our students to call, and basically their job was to just try and call and get information for who then full-time lab staff could talk to about education. So then they did that, got us to the right contact person, and so then the lab was able to reach out and offer 2 things. One, we asked if they wanted patient education, or if we could create anything for their clinics, and or provider education. So we wanted to give even just providers, educate them about our lab, what we offer, and the importance of well water testing and health impacts, and what we offer for our newborn panel. So this was pretty good. We had one clinic that wanted our brochures to keep in all of their prenatal packets for their patients. That included information about well water testing in our newborn panel. And then another large clinic actually had us speak at their all-staff meeting, and that was for their whole OBGYN region, so not just our county. And then we do also have a fairly good relationship with our clinic that serves our Amish and Mennonite community. So we do have a lot of test kits that get distributed to that population as well, and we do see then a lot of samples from them too, which is encouraging. Okay, wrapping up with just some PFAS information in Eau Claire County. So our Wisconsin DNR required testing for a non-transient, non-community system in 2023 that led to a discovery of PFAS above the recommended health standard, serving a charter school. And so we were notified by the Department of Health Services, and what we decided to do was around a half-mile buffer around that well, contact all the private well users and make them aware of what we were going to prepare to help them with sample collection, shipping a sample to our Wisconsin State Lab of Hygiene, and help with interpretation of results. So this is just a little bit of what our letter looked like. We just notified them that within a half mile of their property that a well tested above that health standard. And then we made it clear that we did not know the source of contamination, since that is always a common question that we receive, and that we were just encouraging them to consider getting their own well tested. And then we included some frequently asked questions about what are PFAS, how do I test my water, what to do if I have them in my well, and what can I do to protect myself. So then out of those letters that we sent, 7 out of 21 chose to test, and that immediate nearby sampling revealed 2 wells with PFOA levels around 300 parts per trillion. So then that led to a cascade of buffers and 2 more years of sampling for us. And so results in that whole area then have ranged from no detects to almost 1,000 parts per trillion so far to date. In the Drammen and Brunswick area there, we have a 49% exceedance rate for the health advisory limit. Our county was able to allocate some limited ARPA funding to aid in testing cost. And so the discovery, though, of PFAS in this area then did lead our local university to do a countywide study of PFAS in our county. And so with that, we've had about then 350 total private well water samples for our county. And with that, that is all I have. Any questions? Okay, so I'm gonna go over here. Ooh. Okay, what was the decision process for the inclusion of specific contaminants in different bundle tiers? So if I went back, so in like our premium bundle, that's everything that we can test for, I think, other than pH, which we're talking about adding that to our bundles. And then the next tier is everything, including minerals. So it's including some of the top health related contaminants like arsenic, manganese, lead, copper, and then your minerals. And the last tier is just bacteria, nitrate, arsenic, lead, copper, manganese, things that have an associated health effect or potential. So that's kind of how we decided on those tiers of how to do our bundles. The newborn bundle, we have had that ever since I came to the lab, so I'm not sure exactly what the decision process was for that, but we have always had that at our lab. Has the new equipment positively affected your budget situation? Great question. So we have, that equipment was bought within ARPA funds, and we have been able to, keep up within the bundles of testing, and, receiving a lot of people are choosing to do those bundles with our lab, and, of course, numbers have gone way up. Are we profiting from that? No, but we really are providing our community with important test results for their well water quality, at being a local resource for them, and also just getting a better picture of our water quality parameters in our county. Any specific reason for having the annual discounted testing, on April 13th to the 23rd? I just took a screenshot of our most recent flyer. We usually do one in the spring and one in the fall, because in the springtime, we seem to have a lot of people wanting to test during that period of time, and we do have a lot of cabin folks. So a lot of people are opening up their cabins around that time, so we wanted to offer that discount so they could take advantage of that. What is the reasoning behind recommending testing every 15 months rather than annually? To get that seasonality difference. So testing during the spring, fall, winter is really important because that could change. Is water sample data private, or does the county use or publish the data? I guess we kind of use it internally. We don't have anything like publicly displayed on our website at this time. So usually, as of right now, it is pretty private. We have given our data previously. It was 8 years ago. I talked to the gals from Stevens Point with their water viewer for Wisconsin. So maybe we could do that again. But right now, we don't have anything else. Have you seen an increase in your social media engagement since utilizing videos? Yes. Staying on top of the trends, which I'm not good at, but our other staff are, it has been just amazing watching our engagement of these reels, how far that gets rather than your typical, I guess, like post with a picture. So, yes. And we have seen engagement go up and followers. Does your lab run heterotrophic plate count? Yes, we do. We just do not offer it publicly, I guess, for drinking water. We have the capability to run it. It's a little bit more time consuming to run. So we do run it once a month, but just given the capacity of what we do have, we don't run it all the time. How do the bundles sell by percentage? That is a great question, but I don't know about specific percentage, but most popular are premium bundle by far, especially during the discount. But even when it's not, a lot of people are just looking at that premium bundle. That is the one that we see the most. Second, after that premium would probably then our basic. What is your top piece of advice for other labs on expanding their testing capacity? I mean, that's a really good question. It's difficult for when in a lot of local labs, you have folks that are doing all of your inspections, your restaurants, your campgrounds, so they can only do so much. But I guess my advice would be to just see what's affordable that you guys can implement and feasible, and really maybe we're a lab that we're so fortunate of what we have. And we will always keep, I guess, pursuing more opportunities where we can. Our motivation is just always, I feel like, so high. So just try to do whatever you can. But sometimes it's just really hard. So in that case, it's maybe trying to partner with another local lab or see if they have a little bit more capacity. The newborn bundle is cool. What source of funding are you using to offer this to eligible residents for free? Yes, so we do offer it only for our county, and we are primarily funded by tax levy. What is involved in the 3-year septic inspection requirement? That's a great question. I do not know. I am not in that program, so we would have to ask our inspectors. How did you accomplish this with 3 people? Were the students integral in doing this? They provide us with, so much support to, they pick up maybe the slack of other tasks so that we can spend more time working on these projects. So, yes, they are so important to our lab, and we're always so grateful. We have the University of Wisconsin-Eau Claire right in our backyard, so we get some great students, environmental public health students that come to our lab. But otherwise, it mainly is just us 3, and like I said, we're just a really great team. So we always try to do the best we can with what we have. Our ICP-MS is constantly breaking down or needing maintenance calibration. Have you had to deal with this? Yes. Our chemist, Anna Hilger, is amazing. She is able to troubleshoot so much and really learn a lot on the fly and learn from just published videos from Agilent is what we have for our piece of equipment. So fingers crossed, we have not needed a tech out yet. That is very costly, that we've been able to maintain it and do everything ourselves at this point. How do you like your Tecta analyzer? We love it. It is so nice. And then especially for our home inspectors or our well drillers, it's just nice to email them the results as quickly as possible. And if there's a public water supply concern or a municipality that maybe needs a rush, maybe they have a tower inspection coming up or they need to get their tower back on, there is a bacteria concern, that will analyze bacteria in 18 hours or less. So if you do have a high number of bacteria, you might be able to get a quicker result. So our municipalities and city water really appreciate it too. What is included in your newborn panel? Bacteria, nitrate, lead, copper, and fluoride. Why was the sample courier service not well received? We did primarily try to target, our rural locations where we already have a hard time getting people to want to test their water. So, it was areas where you just, you do have a lower number of private wells, and then you combine that with people not wanting to test. So we did a lot of outreach to the communities that we were there, but just didn't get a huge volume. We probably got, on average, 1 to 8, maybe 8 samples per week. We were there in our rural communities picking samples up. So that's just something that we can't continue. Okay, all right. Can anyone use your lab, like from Illinois or Minnesota? Yes, absolutely. So as long as we still have our capacity, which we do, anyone, you do not need to be like an Eau Claire County resident to use our lab. So we're happy to take samples from anywhere. We do have people mail us samples as well. Can I do the last one? Whew, okay. Did you find that you needed to increase the cost of bacteria analysis via the Tecta, given its cost and low throughput? Yes. Tecta samples are $10 more. So instead of $27 for a bacteria test, we charge $37 using that piece of equipment because the supplies are just a lot more. Thank you, everyone.